Hi, Margaret. Let's talk about hospital overcrowding.
Absolutely. I'm pleased to speak about this. It is such an important issue impacting our health authority right now.
Let's start with an overview of the current situation.
Right now, many of our hospitals are facing significant overcrowding, with a significant portion of our beds occupied by patients who have no medical reason to be in hospital. These patients are sometimes referred to as ALC, alternate level of care, which simply means they no longer require the type of acute medical care our hospitals provide. This vulnerable patient population is largely made up of seniors waiting placement in a nursing home or another type of long-term care setting where their needs can be best met. These patients were admitted to hospital for valid medical reasons and, through no fault of their own, cannot be safely discharged until the right supports are in place. So, with nowhere else to go, these patients, often for weeks and months at a time, remain in hospital when they should be in a nursing home, special care home, or aging with dignity in their own homes.
What impact does this have on surgeries and emergency care?
The impact of this urgent situation is far-reaching, touching nearly every corner of our healthcare system. When acute care beds are occupied by patients waiting to be placed, it significantly limits our ability to admit new patients, whether that's someone being admitted through the emergency department or those who may need a bed after undergoing a surgery. It puts additional pressure on all parts of our system and can lead to longer waits and delays in care for others. It also means care may be delivered in hallways, dining rooms, lounges, conditions that are far from ideal for patients, families, and staff. That's why we're working closely with our partners in the Department of Social Development to ensure patients are admitted to appropriate long-term care placements as quickly as possible. Our focus is on getting patients the right care in the right place at the right time.
How are staff and physicians managing the current situation?
What I see every day from our teams is nothing short of remarkable. Despite these challenges, our physicians and staff continue to display compassion, professionalism, and determination. They're doing their absolute best to ensure all our patients are receiving safe, high-quality care. I'm incredibly proud of their dedication, and I want to thank them for their resilience and their commitment to our patients.
Anything else you'd like to add?
I would also like to thank the public for their patience and understanding as we continue to navigate this complex situation, as well as our patients, including those waiting for placement, and their loved ones, for your resilience and grace. It's easy to want to point fingers when the system feels like it's not working. But the truth is, this situation has been many years in the making. It's the result of our province shifting demographics, a rapidly aging population with increasingly complex care needs, and a long-standing lack of capacity in the long-term care sector. There is no single solution and no one group or organization that can solve this alone. That's why we need to roll up our sleeves and work together to build a more sustainable, responsive, and resilient healthcare delivery system, appropriate care when and where patients need it. Stay tuned to our website and social channels as we continue to update you on our work to address this evolving situation.